be the CEO of your own health. So you have to be your own boss. No one is going to come there. Government is not interested. Insurance companies are not interested. There's no funders who are interested. No pharma companies interested because they want to sell their products to the disease people who have the problem. They have the customers for that. So you have to take the ownership in this area. You have to be the in charge. You have to look deep dive into your data. And there are tools that are available today. You can use them and have a delay the onset of the age-related disorders. And you can do that successfully today.
This week's Millennial Master is Dr. Anmol Kapoor, a cardiologist, genomics founder, and investor on a mission to stop people dying from diseases we could have seen coming. From running heart clinics to building AI and genetics platforms, he wants you to be the CEO of your own health, not a passenger in the system. In this episode, we talk about how AI is transforming diagnosis and prevention in real time, why you should own your own genome and what it unlocks, and the health habits every founder should monitor before burnout hits. Anmol, welcome to Millennial Masters. Where are you joining from today?
Thank you so much for having me. I'm joining in from Calgary, Canada.
Cool. And this is going to link to my first question for you then, Anmol, because I want to know now, when you look back at your early years in Canada, what was the first moment you realized the healthcare system wasn't built for the people like the patients you were seeing?
Well, being a trained cardiologist in Canada, initially I did medical school in Russia, then I moved to Canada, did my internal medicine training, cardiology training and fellowships in vascular medicine, further training in Cleveland Clinic. I recognized there is a need for preventative cardiology during my training years. At that time, my focus was to help identify people based on the carotid artery ultrasound and the risk for developing heart disease. So if I could have an intervention started much earlier, before the disease start to happen in the heart, I'll be able to perhaps prolong their life. As I was working in this area, I recognized heart disease, the blockages in the heart artery is not only the one issue in cardiology. There were so many issues happening where the system was failing, where I am failing my patients. And patients with the heart failure, cardiomyopathy, when there is no blockage, for whatever reason, the heart wasn't pumping as well. And there were so many patients struggling with it. They would come to me and ask me a question, Dr. Kapoor, I did really good. I don't drink alcohol. I don't smoke. I exercise. What people say I do, what research says I do, why I still develop heart failure? Like, what did I do wrong? And I would not have an answer. So this was happening quite often, and I saw young patients who were struggling, and the healthcare system was lacking answers for them. And then I had patients who coming in, they said, look, Dr. Kapoor, I got a blockage in the heart arteries. I take aspirin, I take statins, I take blood pressure medication, what you prescribe me, or the doctor prescribed me. I still got worsening of the disease. Like what is happening? So I didn't have an answer. And some people have a recurrent heart attacks and other people will not have it. I would not have an answer. So every time I would say, maybe genetics, maybe by chance, let's try some different medication. So this hit and trial approach was a medicine standard, or it is a medical standard in many parts of the world today. So I didn't want to be part of that standard. I want to change that. I want to find answers for my patients. I want to deliver them better care. So that desire made me look into this area in about my 5th and 6th year of my medical practice, where I recognizing that everything I was trying, it was not working in a traditional manner the way healthcare system has been made. So I have to try some different approach for my patients, but the system did not have a capability or the power to be able to bring those technologies or the access at a consumer level. So that's where the disconnection was and where I put my efforts into it.
And I'm assuming that that was the point in time as well that pushed you from being just a cardiologist to someone who wanted to build solutions outside the clinic? Because am I assuming correctly that this type of
It
preventative
was
method and research doesn't apply just for Canada, but for most of the
globally.
healthcare systems in the
It is.
world?
It is.
Yes.
And in fact, my first venture that I went into was Cardi AI, one of my companies, the initial ones. I had no idea how to make medical devices. Not a medical training. I'm not an engineer. So I don't know ISO certification standards, and I didn't understand anything because I've not been taught about that in medical school, and didn't have a desire to learn because I was planning to be the doctor. So I had a patient, and I was in Orlando attending a conference for AHA. So I got a call from one of the nurses. There's a charitable clinic we opened in Calgary, the clinic for heart failure patients. And this was before COVID time, like era of 2016, 2017 period. At that time, the standard of practice was in Canada, probably is still in many places, that when you're having a difficulty breathing, when you can't breathe, you go to emergency room or go to see a doctor, and doctor will order the blood test. If you're not in emergency room, doctor order the blood test. You will go to the lab with the requisition, get the blood test called NT-proBNP, and then a report will come back to the doctor. You go home, and the doctor will get the report in day or two or three. In the meantime, doctor will try to adjust the medication based on the guesswork with the water pills to see if you're feeling better or not feeling better until they're waiting for the result. So imagine when you can't breathe, you're drowning in water, your lungs are full of water, and you're dragging the patient, and patient himself or herself dragging to the lab for the lab testing, and so that data can help them and the doctor provide them better care. It was a struggle for this patient, and his so my nurse calls me. It was a charitable clinic we opened up through one of the foundations we founded in Canada in Calgary. Even though we have public healthcare system, still this patient we have to provide care through this charitable basis. So nurse calls me. The patient is very angry, and I talked to the patient from Orlando, and he said, "Dr. Kapoor, I know you're really trying to make me live long." But I have become a burden on my family. My son has to take time off every time when your nurse asks me to come and get checkup and get the blood test and go to lab, get the requisition, and all of those process was happening. He has to take a lot of time off, and it is impacting his work life. Because of that, is impacting his social and personal life at his home. I know you really want me to live long and stay healthy as long as you can, but please let me go. Don't fight for me. And I said, why? He said, because I don't want to I've become a burden on my kids. I've become a burden on my family. And not something I wanted. I wanted to make sure that I have a good quality of life, but at the same time, not becoming a burden on other people. I kept helping him through a charitable foundation, getting some resources through a taxi. Someone can go pay, get his blood collected, and then we can get the blood test done and get the treatment delivered. So the system wasn't working. So that's what motivated me to find a way how I can pick up NT-proBNP, a biomarker for heart failure, in people's home. So that's where my desire to get into biotechnology, diagnostics, and many different areas.
And people who have been in regular jobs and started a business would possibly look at it in the same way, because you moved from practicing full time to and being a doctor to operating and building infrastructure for the medical profession. How did you adapt to that? You said you weren't taught that, but a lot of the stuff in business tends to be self-taught. How did it go for you?
Well, it was reaching out to some of the consultants. I was attending some of the conferences in this area where I got to know that I would need certain engineers, certain team of scientists. I will need to create a quality system where I could start doing research and development. I applied for funding. It was in Canada, we do get a support from federal government where they do provide some funding. So they gave me that funding opportunity to try and take a risk because it's a huge
So they were
investment.
like an investor
You can
your
call it
venture?
non-dilutive investor, exactly. So the government comes in place. So if there's a unique problem that needs to be solved, it has not been solved by anyone globally. So then they vet the idea, they go through it, and then they invest money. So allows us to then, me as a innovator, take a risk. So the project could fail or succeed, doesn't matter for them. They want this innovation to move forward. And so that is taxpayer funded program. And that was the first investment I got, which is non-dilutive. And their main purpose was to push this idea forward.
And you previously said in another podcast that modern healthcare is built around the late stage disease because that's where the money is, at least in the private sector. So, what did you identify as the business model that made early prevention actually viable?
Well, what I say there are two kind of systems, and one is a healthcare, one is a disease care. But what has become is that we end up managing the diseases. So the governments all over the world and the patients all over the world, they get they get access healthcare when they are sick. When they're sick, that becomes the disease care model.
And that's
This is
in
how
a
the
way
model has
too
been
late.
running. It's too late. It's already happened. So at that time, we are having a heart attack, heart failure, cancer, diabetes, COPD, kidney failure, the top killers on this earth. And at that time, it's too late. So now we as a company, or we as a society, or we as a funders, so we are now focused on how to manage this problem. And the families also are committed around that time. But no one is committing before the stage when you're the healthy, the actual healthcare. So the disease here got named as healthcare, but the healthcare is no one spending money and efforts in. Neither the individuals are committing, no funders are not interested to fund it. Providers don't want to cover those things, and the regulators don't want to focus on that. They're all focusing on the drugs, the treatments that are getting developed based on the disease detection and disease management. There's no efforts toward disease prevention and finding ways how to delay the onset of diseases. So that's where the new models comes in, where I have to reach out to the patient and make them partner in their own health, with the slogan, be the CEO of your own health. So you have to be your own boss. No one is going to come there. The government is not interested. Insurance companies are not interested. There's no funders who are interested. No pharma companies interested because they want to sell their products to the disease people who have the problem. They have the customers for that. So now, so you have to take the ownership in this area. So you have to be the in charge. You have to look deep dive into your data. And there are tools that are available today. You can use them and have a delay the onset of the age-related disorders. And you can do that successfully today. So that's a model and the message I have to get across to people through podcasts, through social media, through one-on-one interaction, that we have to be the responsible in this case.
And another thing that you've also been vocal about, in the same vein as being the CEO of your own health, you believe that people should be the CEOs of their own genetic data and own it. What does that mean? How do you break it down? What's the background to that?
Essentially, in Canada, as per the law, Canadians own their data, but the data doesn't stay with them. Data stays with the doctors or the healthcare providers. So they became the custodians. So people who own the data, to access their own data, they have to pay money to the custodian. And the custodian then gives their data back. So they always keep a copy, but people get a copy on demand. So the system is broken. Even the law has enshrined that me as a citizen, is the owner of the data, but someone else is in the custody. Someone else can make a profit out of it, and without me ever knowing. Genetic information is very sensitive in many parts of the world. In Canada, we have the laws to protect it, to make sure people don't get exploited. But in many parts of the world, in America and other places, the insurance companies could decline healthcare coverages, etc. People information sensitive can go in the wrong hands. So what I want people to own their information, own their data files, This way, they can decide what to do with their data. They want to sell their data, they want to donate for research purposes, they want to pass on to next generation, next family member, or the grandkids, because DNA data is your essentially ancestry, where you come from. Yes, you are looking to pass on the car, the vehicles, the houses, the lands to your next generation. And also make sure once you own your data, as you are the owner, you should pass on this file to your next generation. This is an asset. This is not your liability, because this will help them along the way. Tomorrow, there could be a system where you can sell your data. And there could be companies or funders who will be interested to buy data from you. So this way you're empowering yourself, you're empowering your families in their financial stability. At the same time, you're helping the ecosystem move forward, build trust. Because right now the trust is lacking. So there are many companies across the world, without naming,
Hmm.
they went bankrupt recently, and people were not able to access their own data. They went to the court to stop selling their data. Even the courts did not align with them, and they aligned with the company, and they allowed selling of their data to the third party company, and they have no control.
And I'm assuming here you're talking about a popular ancestry website in the US and Canada, which had to do that recently.
Yes, yes.
And you said that, you know, this data can be sold. What's the actual value of a person's genetic data?
Value could be huge. So as simple as that, as this company sold their data to some other third party company, and they have about, as well published news reports, around 16, 20 million people data in that range. And they got valued around 15 to $20 of data per person. And that data just a very small amount of data. It was not a whole genome sequencing. It was just a small snips of data. It's like a one chapter of your book. But when you
Hmm.
have your whole genome file, and if you have a whole genome file of your whole family, and think of this, you have 50 family members. And in the future, even the current today, the valuation of that data is anywhere from $300 to $500. So if you have
Mm.
a 10 family members or 100 family members, imagine how much money you have. You owe it, but someone else has a copy, and someone else is deciding your destiny. So they're profiting, selling your information to some third party company.
So, is there any correlation then between, like you explained, seeing your family tree and the genome data contrasted to not having that? Because if you would go to, say, your typical doctor appointment with your GP, you wouldn't give your DNA data to be looked at and tested, at least here in the UK. Is that the case in Canada?
In Canada, we have public healthcare system. So usually genetic tests from preventative side are not covered by healthcare system. So you'll have to pay privately. When you
Okay.
go see a family doctor,
How
usually
much is one of those in Canada?
from one of our companies. So we are
Hmm.
one of the cheapest and the more accessible companies globally. So in Canada, it costs around $700 USD.
Hmm.
Or globally, anyone can pay same price. No difference between for UK population or a someone from America or in Canada, they pay the same price. So you can basically convert that into local currency. So that could become a less than $1,000 or roughly
Hmm.
$1,000 in Canada, and probably roughly a 500 pounds in UK.
Yeah.
And what we also do is we also offer people lifetime reanalysis, and no company globally offers that. Why we do that? Because why the genomic data interpretation keep changing. So your MRI that was done 1 year ago or 2 years ago, that report is now old, is useless depending on the clinical context you have today. You may have stomach pain, but 2 years ago MRI report was normal. So it's useless from that perspective. It just tells us a baseline, you were normal on that day, but you need new MRI or new CT scan, new ultrasound, because you have a problem today. Your DNA never changes once it's downloaded, but the interpretation keeps changing because of new research getting published, new data coming out. So genes which we tell you 2 years ago or 1 year ago that those genes likely were pathogenic or maybe pathogenic, and some genes were unknown significant. We have no clue, or the genes were benign. The ranking keep changing. The way remember COVID times, Omicron, Deltas, they keep changing the rankings, becoming more infectious, more serious, some becoming more benign. Similar way, your genes standards and the ranking keep changing every year or so, where the new publish research comes along the baby, and then gives more data to support whatever the diagnosis we have done before. So people should be reanalyzing that data. That's very, very important. So we offer a lifetime free analysis, being the only company on this. Once a year, you should get a data reanalyzed.
And that's how you track changes as you age, and you can then prevent diseases before you have an onset.
Exactly. So once you know the predispositions, once you know the medication you could be having side effect, now you can take preventative action. You can take the right medications at the first step, not at the third or fourth or fifth step. And if you have a risk for developing some disorder, it could be dementia, could be perhaps cancer, heart disease, or having a higher chance of developing high cholesterol. As simple as that. And treatments are available. So if a doctor is recommending you take a statin because of high cholesterol and you're getting muscle aches and pain. But based on DNA analysis, we see that a genetic predisposition that favors different drug approach, which is a PCSK9 inhibitor drugs. And they're more expensive, but doctors giving you statin, which you will likely will not respond as effectively. Instead of continue taking statins and the side effect potentially with it, why not move to the drug which is good for you? That can delay the onset of heart disease for you. So as simple as that. Some people say, look, what do you discover in your DNA sequence? You can't change anything. And I want to mention this example of high cholesterol. That's the example is there where you can change things. If you have a risk for developing a prostate cancer, doctor can follow you much more closely with PSA testing without just ignoring it at a certain age and just checking after 5 years based on the guidelines. So the test today, doctor has an access. They are not complete tests, but once they know the risks you may be at, now they can tailor make those follow-up plans for you.
And for anybody who hasn't tried testing their first genome or biomarker, how does it actually work? Do you send a blood sample, or what do you people have to send in order to have their genome read?
Basically, you can take sample two ways. One is through a swab and one is a
Hmm.
blood. I do believe in the blood sample sequencing because we get a better quality DNA. Because sequencing means is that we are going deeper layers of the DNA. And
Hmm.
the deeper you go, the more genes you can uncover and the more variation you can uncover. So from the buccal swab or the saliva, we don't get a good quality DNA, but it's convenient. So most of the disorders we can pick it up. But if you are struggling with a rare disorder, I would recommend make sure getting it done through blood sample, which can be
Hmm.
taken through a finger prick or which can be taken through a various at-home testing kits you can use from the arm, you can use from finger pricks, and just ship the sample to our lab where our team goes through the data. And once your sample processes, they notify you securely where you can see your information.
I'm curious, Anmol, because um, I know you've started with the genome and biomarkers, but now you've integrated AI across diagnostics, triage, patient flow, labs, and a range of other solutions. So, what were the first steps to do that from moving from a doctor to basically an entrepreneur? And how did you approach them and started increasing the products and the solutions you were developing, which, as I understand from what you said earlier, were filling gaps in the healthcare system because you had an intimate knowledge of it from working inside?
It's a large amount of data. Doctor, me, I have to look at those data sets to come to conclusion for my patients. If I'm exhausted, if I'm tired, if I'm really good in the morning and fresh, had a good night's sleep, I'm probably paying more attention to my patients. But end of the day, I am more exhausted, more tired. Probably I'm rushing through it, and there's a possibility I'm skipping and missing the data. So based on data, I'm probably making the wrong calls. So we as a humans, we have a variable patterns. We don't recognize that. Doctors working 8 hours a day doesn't mean doctor is consistent in those 8 hours in predicting things. So mistakes are happening in healthcare system. Why? Because doctors are overburdened with data and so much paperwork they have to do. I do believe AI can work like an assistant, like a medical resident,
Hmm.
like a medical student who can gather all this information, clean up things what needs to be cleaned up, and give the precise summary so they can make a right call at the right time and they can go back to becoming humans again instead of becoming a data entry clerk these days in most part of the world these days. And DNA is a large amount of data. One DNA file is about, if you're sequencing at 30 times the depth, is about 100 GB file. But if you
Oh.
sequence the same file at 100x, that becomes a half a terabyte. So you can imagine if you're sequencing, the deeper you go, the larger the file becomes. So you have to now identify 1 in 8,000 billion variation in that human genome in the right manner, in an accurate manner. And you want to be fast enough. So that's where AI comes in play. Is we deployed our own ALLM models built in house in Calgary, which allows us to accurately predict and identify the disorders from a VCF file in less than 5 minutes. It is a record breaking technology. Without AI, it takes weeks to months to
Mm.
get a clinical report in people's hand. So AI revolutionized that. But we don't want to stop there. We have identified the predispositions. Now we want to link that data to the MRI, the ultrasound, the blood test, the CBC, the lipids, the kidney function your doctor has done, and combine them together. So it makes sense to me as a doctor. Because when a patient is in front of me, when you're in front of me, I want to be empowered and knowledgeable to give the best advice to you at that time. So that's why we're bringing things together in an AI.
When I went back at the end of September to London for the AI in Health conference, one of the conclusions that I've drawn from 2 days of discussions was similar to what you're saying, that data is very important and access to data. But one of the barriers, at least here in the UK and across Europe, seemed to be who owns different types of data. Like your GP will have some basic information and what they collect from you, say in consultations. While when you go to have an MRI at the hospital, you don't have access to that data. It has to be sent across either different departments or different hospitals, and it doesn't always do so. How did you manage to circumvent this issue where different parts of the healthcare system have your data in different silos and then being able to bring it together in a coherent way?
It's a work in progress. So I can't say I have figured things out. Why? Because people like to control. People love
Hmm.
power. It's a natural animal instincts people have. Even though they know this is someone else's property, they still want to control them through to whatever way is possible. So healthcare systems know that they don't own this data. Yes, it's taxpayer funded data, but it's a taxpayer who owns the data, but they still want to control. So at the name of privacy breaches. So sometimes they use it trying to keep the data control protected and decide the future of the people whose data they're controlling. It's a power struggle in the fight we are doing. We have to fight globally.
Hmm.
So there are some healthcare systems who are very progressive, very open and positive. So they do.
Any particular examples of the positive and progressive healthcare systems?
Well, Alberta Healthcare Services in Alberta. I'm from Calgary, so very progressive and positive. So in Alberta, from the taxpayer perspective, there's a mobile application called My Health. So it allows people to access their blood testing, their MRI, their ultrasound reports in their mobile application,
Hmm.
and they don't need the doctor approval. So they can access their own files that are in the central repository, and what is not in central repository They're connecting those clinics, outpatients into the central repository. So everything goes into the one place where people can access information, and me as a doctor can access information in timely manner, irrespective of the whole province I'm logging in from. So by doing this, now we can have a unified access, and the people have an access they can see. They can demand if someone is accessing unauthorized. They can ask an audit where tax funded organizations have to provide information who access your data. And by doing this, they're helping us build trust among the healthcare providers and also among the patients. So that makes my life much easier in Calgary. But if I go other provinces, if I go other part of the world, they may not be as open. They
Hmm.
don't believe people should have an access to data. For example, you go to Toronto or Vancouver, people don't have an access to data. The system is fragmented between hospital to hospital. They don't even talk sometimes.
Hmm.
Where you have to still use faxes. You have to send information via fax, receive via fax.
Okay, so even in 2025, yeah.
Yes, fax is in every medical office in Canada. Every medical clinic is in Canada is they have a fax machine, and the data still moves through fax.
And digitizing it then, or redigitizing it, also means that it's not always as accurate. Would that be a correct interpretation? If you send an MRI scan through a fax and then it gets printed out, it wouldn't be as accurate as the original digital file. Or am I
No, it
missing something?
accuracy is not the issue. I do believe. I think there's a fear of. I'm going to say something controversial here.
Yes, let's
So
do it.
okay, so if you're going to send me a file, MRI file, to me as a doctor with a central email and a repository, digitally can come in immediately without any problem. And there are EMR systems now, they get those, sometimes those files, not all of them. So, but the fax systems has been designed, I believe, probably, designed to protect the doctors also
Hmm.
and the healthcare system. Why? Because if a digital file comes in and 24 hours those files are coming in, that is going to be put a liability on the doctors that why they haven't reviewed these files on time. And by
Okay.
having a information sent via fax, that gives them the delay where the files are coming in a slower manner, which gives them a time to catch up and review them. But since the faxes files can be lost, sometimes this liability even doctor should be taking control of it, but mistakes can happen. So I do believe the system was created to help improve the communication, but same time now in the today's day and age getting misused to help defer the liability and also have some time reviewing the files. So if everything shows up on time and the doctor inbox they are flood up, they will not have time to review all of them.
And that's where AI comes into place, right?
Thank you for saying that.
So you said, Anmol, that you developed or implemented your own LLM. Take me through that process. A lot of people would say develop a layer on top of typically OpenAI, ChatGPT, sometimes Claude, or some people are looking at models such as DeepSeek because they use fewer resources and in certain situations they can be just as good, if not better. How did you go about doing it?
Well, nothing wrong with using multiple LLM models. They are like any other human. Some are really good, some are bad, some are good in one way, some are good in other way. So ChatGPT or Grok or Cloud or Gemini, they're really good conversational models. But are they good in deep diving into the whole genome file and bringing out the data analyzed in medical grade manner? No. They're not trained that way. Yes, in the future they could be, but that's where we
Yeah,
invested
the
resources
context
and
window is much smaller than what the genome data would be.
yes, yes. So it is
Even a
it's a large file.
50-page document could be
Yes.
too much context. And for example, I was discussing with an entrepreneur in the legal field, and he was explaining to me that once you, say, upload a 50-page contract draft in ChatGPT and ask it to summarize it, it would actually only look at a certain number of pages until it runs out of context, and it will summarize those, while totally ignoring the rest of the information supplied in the document.
Exactly. So individualized, personalized context matters. I'd want people to understand there's Google or there is a Bling and other browsers, search engines we use.
Hmm.
Similar way, the conversational common AI works identical the same way. They are not as accurate as a more personalized LLM model that has been created for that particular problem, that legal
Hmm.
problem, or a whole genome analysis or multi-omic analysis, a large amount of data in that patient context. Why? Because they're not trained that way. They're not designed that way. Similar way, you have
And
a
they are
doctor.
trained on generic internet data, so
Yes, they
it's
can
one of
cause
its downsides. Yeah.
misunderstanding. Exactly. So if they're reading a tweet of a some bot and the bot is spreading the false news of some drug from animals to be used in human,
Hmm.
and that AI will start to learn it. Oh, yeah, everyone is supporting this, must be true. So AI
Yeah.
is like a human also. If you are getting influenced by the same misinformation, there's a higher chance AI is also getting influenced by the same information, misinformation. So if to take a right call, you need that context, the clinical context, the legal context, the engineering context, the architectural context. So from that perspective, there is a need for specialized LLM models. The way we have employees, the way we have specialists in those areas. So this way we can have a trust. We can take the right call. We understand that yes, it's a conversational, it's good for entertainment, good for fun, but hey, it's a medical call. Let me make sure the LLM model I'm using is the right.
And which one did you go for?
Well, we built in the first engine called Panomic, and the Panomic was the engine we come up with. It's a large amount of data. We wanted to
Hmm.
analyze it. You measure 100 GB data, identifying one variation among 8 billion.
Yeah.
So
Okay.
we have to do that. We did achieve that 7 hours first. Then we achieved that a few months ago in less than 5 minutes. By improving those models and how the data is coming in, how the data interpretation is happening. So now we are taking this more deep dive into genome of the human. So the earlier part of LLM was at the late stages of genome analysis, the third stage of the genome analysis, where LLM becomes much easier to handle that particular amount of data. So now we are adding the another layer to that. That layer is going more at the first stage of the genome analysis. Well, as soon as the sequencing is done, where the primary file is created, now we are applying LLM model right there. And people would say, why? You already got your tertiary analysis done, and that's much easier, faster, accurate. Why not move ahead? I believe we have identified around 20,000 plus genes right now in human genome. But I do believe there are many other genes which we have not understood yet. We have not uncovered them yet. And the function of those genes is unknown to us yet as a humans. I think the book is not properly read yet. So if we're going to apply that LLM models to the first stage and the second stage, their interpretation becomes much accurate. If I'm going to apply just on the third stage and the interpretation, in the
Hmm.
clinical reporting. So the first and second stage could be wrong. So if my first two stages could be wrong, interpretation could be wrong also too.
Yeah. So, Anmol, if, and I'm guessing all LLM models can hallucinate or make mistakes sometimes, maybe not be fully accurate. There's a controversy in the general LLM world. Who is responsible when, for example, allegedly ChatGPT suggested to a teenager to kill themselves? But when you look at biomarkers and preventing diseases, a small omission can also have big consequences. In this context, who is ultimately responsible? Is it the doctor, the practitioner, the specialist, or the software and solutions provider such as yourself?
Let's simplify the problem.
Even
And
better. Yes, let's do that.
exactly. So let's make it much easier. So we drive every day and there's a seat belt, and the law says everyone should be wearing the seat belt. And many people wear the seat belt, they follow the law. The law was created why? Because people live longer if they get an accident, at least increase the chance of surviving the accident. But it's your choice. You don't have to wear a seatbelt. It's not mandatory. Many people who sit in the back seats in across the world, even though it's illegal, they don't wear the seatbelt. And they sometimes just the front end drivers and the passenger wear the seatbelts. It's
Hmm.
a choice. Tomorrow something happens, you are taking the risk. This is the same way. Models are the tools. They can be used in the right context, right manner, like any internet search you've been using it before. But from an individual perspective, you have to know they can also lie the way humans can lie. There's a high tendency of humans lying, trying to impress you, trying to make sure they look really, really good in front of you. And we make up stories. It happens all the time. Our friends make up stories. We know that. So our LLMs are a reflection of our humans beings, how we are. So how we think, they think that the same way. So we expect them not to hallucinate, be 100% accurate, but humans can lie all the time. It's okay. On TV, on record, looking straight in your eyes, they can lie, but that's okay. And that can potentially harm too. So I do believe a consumer has to be aware. A passenger should be responsible for their own luggage. So I think they should use information in a clear mind, not believing the LLMs are telling the truth and making sure cross-checking with the professionals before they take an action for their life. The drugs they want to take or the test they want to do, in similar way, you want to make sure that the seat belt you should wear the right way. And if you don't know, ask the people how to wear the seat belt properly. And if the humans are lying to you, go to some other human to cross check if this person is lying or telling the truth.
So, when there's a certain advice being given by a practitioner, because I think, again, if I'm going to come back to the conference that I attended, in the current context, at least in the UK health system, the clinician or the doctor or the practitioner are ultimately responsible of the advice and the actions that the patient is recommended, even though, there's an AI tool in the background which analyzes that.
It is same way exactly. Nothing changes. A doctor goes to Dr. Google and searches a study, and they based on the study, they find that this drug is good for the patient, or this test is good for the patient. Responsibility
Mhm.
still lies on the doctor because they're deciding information in the context of that patient. It's a responsibility on them to make sure the study they're reading or the guide they're reading the right guidelines. So similar way, LLM models can help them assist. They still have to use a clinical knowledge, or the lawyers have to still use their legal knowledge to help guide the client in the right manner. Responsibility is still on them as a professional providing care to those people.
So now that you're building a series of products with AI, as I mentioned, diagnostics, genomics, triage, patient flow, labs, where is AI actually reducing cost and risk today in these areas versus where it could reduce the risk in 5 years' time? Because I'm assuming the impact will also be exponential with better and improved releases of the LLMs.
It will be. AI now is really good in diagnosing radiology related disorders or the problems we identify. So AI is really, really good in that. AI has become really good in the variables where we can monitor people from arrhythmia, defibrillation, etc., that can happen and impact the patient, increase risk for stroke. But where the big challenge I see is bring all this data sets into one, into that context of the patient. And it's a large amount of data is fragmented. There are many lakes all over the world, and those lakes are not talking to each other. There's no water flows between the lakes. So now LLM models are only interpreting what they see. If they can see, they can't interpret. It's like if you don't see a camera, camera don't see you. You will not be in the picture. Similar way, so LLM models can only interpret the information what they can see. So I do believe as time goes along, more healthcare systems become open to offer this data for LLM models to learn from various experiences from the clinicians. The better they become, the faster they become, or more accurate they become in predicting it. But the biggest challenge will still be there's a human variability. So LLM models can only do so much. But if I have all the information and knowing that smoking is bad for me, I still go out and smoke with all the education, all the taxes implemented by the governments globally, with doctors educating, banning smoking in public places, with all this effort putting in, people are still smoking. So that's a human behavior. No LLM model can change that behavior. So humans will have to take responsibility.
Ultimately, whether it's the patient in the way they look after themselves and the habit, but also the clinicians and the professionals in the way they assess information digested by AI, right?
Exactly.
Now, just trying to move a little bit into like the business mechanics and your learnings as an entrepreneur and then as an investor as well. Because I read another interview with you where I see that you work with people who run at like 120%. And that's an obsession for entrepreneurs to be more productive than anybody else, to be able to go get ahead, outrun their competitors. Has there been a genomic or biomarker signal that you've seen in somebody's DNA that a founder should pay attention to if they want to perform at a high level for decades, not just for a short amount of time?
Yes. So we did one of our companies called the Biosport, biosport.com. So
Hmm.
we are using this information to identify the superhuman powers among the humans.
Okay.
So there you go. So essentially, all of us have some superhuman powers. Me, I believe I can make muscle and I can become a bodybuilder and I can look really good. But as I was exercising, I would have a muscle aches and pains that last for too long. I never understood. I always thought it is a lactic acid buildup, blah, blah, blah. And perhaps I'll do more, drink more water, and be able to push it through next time. But what was happening was in my life, if I would not exercise, I will lose my muscle very fast as compared to my friends. And I said, why is that? Like the guy does the same exercise, but his muscle can last so long and my muscles are gone. Like what's going on? So Biosport, when I did my analysis through a polygenic score, bringing all the genes together and using lifestyle score, we call BioFit score. So it allowed me to understand that the muscle fibers are born is not designed to make me a bodybuilder. So while I was developing micro tears, they were hurting, and those micro tears were the reason I was not able to push forward. And there is genetic reasons I have that my muscles regress from hypertrophic state to a normal state much faster than other people. They stayed hypertrophied for longer time. And I also learned my superhuman power is in endurance sports. Had I known, I would have pushed in that area. But I kept getting injured in the sports I didn't want to. I wanted to play. The sports I wanted to play, I was getting more injured there, not knowing my genetic makeup. And the sports I could have excelled, I didn't know, and I didn't put the effort into those sports. So the biosport is a very unique technology. It helps reduce the risk for sudden cardiac death on the field, rule out cardiomyopathies and the risk for heart diseases that can potentially kill a person on the field when they push a limit. And at the same time, tell us about our capabilities. Are we good in muscle building, endurance, power, speed, and many different areas which could help us decide and perhaps reduce the chance of getting injured on the field and excel on the field much longer and stay healthy longest as a sports or as an athlete. And the same technology can be used for military, for police, where we subject humans to extreme stresses, where we put them at risk of health risk, knowingly, unknowingly. Yes, we defer the liability on the doctor's still. A patient was cleared. This police officer was cleared by the cardiologist. Dr. Kapoor cleared it. He had a heart attack. It's not my responsibility. We pushed him, but he died. But Dr. Kapoor had cleared him. So that's the system we have created
Mm.
right now. And every athlete, every police officer or elite soldier, they go through this medical checkup. But the medical checkup is a very rudimentary way. They check your blood pressure, heart rate, ECG, stress test. Okay, you go extreme stresses. And many die along the way. We don't talk about that. We accept them as a casualty. It's okay. But using biosport technology, you can be more precise. You can better triage those police officers, those soldiers, and pick the right ones for the right task.
So, Anmol, then, if I understand this correctly, would you say that our genetics, we are predestined based on our genetics for the rest of our lives? And do genetics also give off character traits such as, say, resilience or any mental acuity or talent? And also, if that's the case, to bring the whole trifecta here into the question, should we have biomarkers and test the genomes from since we're children?
Thank you for saying that. Everyone should get their whole genome sequencing. There's never too late. Some people say, I'm 90-year-old. Should I get it done? Definitely. There's always a value. But the bigger value is when you are young, when you have a whole life ahead of you. So you can take the right calls at the right time. So every human at birth or the kids we getting born in the future, they should be a whole genome sequence. The benefit is we rule out any rare disorders much earlier. We can triage them much earlier from autism, from Asperger's syndrome, or many other spectrum disorders. As parents run around and they waste the time, it costs a lot of money to healthcare systems.
Yeah.
And that justifies that investment into sequencing every baby. But at the same time, it does provide some insights to the parents from the intellect of the person, or the height of the baby could be, and the sports they could play, and the risk they potentially could take, or the risk they could have. So this information is very helpful from a parent perspective, because we are always looking for new data sets, how we can keep our kids safe and still they excel in school, and they excel in the jobs when they leave the school life. So all this information, the earlier we can provide them, the better it is. So I strongly believe in that every baby at birth should get a whole genome sequencing. In fact, we had few parents, they got the whole genome sequencing through a sample taken through umbilical cord. Because as we're taking the umbilical cord sample, so they got their mom's DNA, they got the baby's DNA in the same sample.
So even before you were born, basically, you can test your DNA.
So now let me tell you one more thing on that. So there is a hospital in Saudi Arabia. So I visited and spoke to them a few weeks ago. They have a pre-implantation genetic screening program.
Okay, let's break that down in plain English. What does that mean?
Okay, so people, mom and dad, are designed, or they have some recessive disorders, and they want to make sure the baby that is going to be taking a birth does not carry that dominant gene that could cause the disease. So what they do is they have screened mom and dad, and they have decided that there's a higher chance the baby they will have the disease. So now, so they use the in vitro fertilizations. So embryos get formed. So embryos get a genetic testing done. So if someone has 100 embryos, so they sequence each of those embryos and pick the embryo that does not have that gene expressing and implant that embryo into mom, and that baby is born without any disease.
So not all embryos in a woman's womb would be carried all the same genetic markers. Is that my correct
Yes,
understanding?
exactly.
So there's a factor of luck there in a way.
Yes, sir. So now the luck, you can change it by sequencing of the embryo before implantation.
And how soon in the fetus development is a full genome developed?
Once you
So
have
when is our
embryo,
fate sealed, basically,
once you're in
genetically?
embryo stage, our fate is sealed. So we can then decide, should we go ahead for birth, or should we have the better of ourselves to go for the birth? So the embryos, so if I have 10 embryos, and those 10 embryos, as before I'm going to implant unknowingly, I may be able to pick up a random embryo and implant it. So when that is happening, so I'm maybe implanting the embryo, the baby, with a genetic disorder. But if I know I'm going to be implanting the one that does not have the genetic disorder. So the baby will be more healthier when the birth is taken place, and the babies will be able to grow without the disease.
And can you, for example, pick positive markers such as I want my child to be tall and slim or muscly or blue eyes, for example?
Yes,
Can you go
you
that
can.
far into it?
You can, and there are some centers globally who offer
Hmm.
that service privately, obviously not paid by the taxpayers. And yes, it is possible.
Okay. Now, this one is going to stay with me that your faith is sealed from the moment, the embryo is picked and it creates the genome. But I'm wondering now, Anmol, when you look at founders and entrepreneurs under 40-ish, the millennial generations, what are the health mistakes you've seen them make that have a high cost on them 10, 15 years later? And here I'm trying to extract advice for fellow millennials and their health habits.
I would say sleep well. Sleep is the biggest medicine,
How many hours
and
a night?
7 hours minimum.
7 minimum. Okay.
7 hours minimum as a good quality sleep because your
Hmm.
body needs time to heal and get rid of the bad things you don't need.
Hmm.
That's very important. Second thing is make sure you follow the sun. Wake up in the morning and make sure you go sleep at nighttime. Don't stay awake at nighttime and try to sleep during the day. You
Hmm.
need to follow the rhythm because your body's designed, your hormones are designed that way. In the morning, your cortisol levels are high, your other testosterone hormones are higher. At nighttime, you're having a melatonin coming up. You need to follow your body's signals. Don't stay up late till midnight and try to fall asleep and fight sleep. Go to sleep early on.
I'm a night owl. Okay. And what about anything relating to diet? Obviously, you are a doctor, so you're not going to recommend smoking. Is vaping a better alternative?
No, sir.
Okay. Well,
Anything that is your smoking doesn't
hmm,
matter is bad. It's a chemicals and vaping. They have chemicals. We have
hmm.
seen lung fibrosis. People capability to absorb oxygen in their blood has
Hmm.
damaged. We have seen bad cases. So any type of smoking is bad.
And diet-wise, is,
Diet
is
wise,
is vegetarianism versus veganism or meat consumption has any impact?
what I see, Mediterranean diet has been more favorable from
Hmm.
a cardiac perspective to help live longer, reduce the chance of certain cancers. Personally, I follow no red meat diet, and I follow 90% time I'm eating more fresh fruits and vegetables,
Hmm.
more whole grain food. Instead of a white bread, I will tend to eat more brown bread. Instead of drinking juice, I'll eat fruit. So I'll follow those simple principles. But I do have fish in my diet. I like salmon, more colorful fishes, more
Hmm.
omegas, more good for brain health. And if I really have to have a meat, then I tend to pick a white meat, like a chicken breast, better than other meats. So
Hmm.
those will be my personal choices I follow.
Something that quickly came to mind as you were saying that. Here in Europe, genetically modified fruits and vegetables and produce are not available commercially. And I know in the US, but I didn't actually check whether they are in Canada. And I wanted also to have your take on this because we're talking about genomes and genetics.
Well, we do have few things genetically modified in
Hmm.
our diet. Canola, which is a modified mustard seed oil,
Hmm.
quite readily grown and exported and consumed. We do have a certain modified foods coming in, but not to that extent as in America. So we still have a less hormones or less antibiotics showing up in our milk side. So
Hmm.
the milk line is very protected in Canada versus in America. So we don't get a GMO coming in. But yes, it has entered in many different places. Has it shown a huge negative impact? Not as much yet. But as
Mhm.
we understanding that instead of genetically modifying a plant or an animal, we can follow the natural selection, identify the resilient plant or animal that can last to give us a better taste, better yield to the farmer. So I do believe the push is happening in that way, or understanding how to express that gene in that plant or in that animal that can make it much more desirable and more nutritious. I think more push is happening in this area in Canada and globally as more people are getting more aware of GMOs, because the GMOs of initial stages came in the toxicities, right, are involved with that. But where you're
Mhm.
just expressing the genes, not changing and adding the toxicities inside, it is essentially the same thing. When you look at a Wagyu beef coming from out of Japan, it is a beef because of natural selection. So they identify certain genes are expressed as much more better buttery beef comes out versus other cows. So they just
The layers
grew
of
the cows.
fat in between the
Exactly.
yeah.
Exactly. So they start basically growing the same kind of cows again and again. So that became a over time part of natural selection. So every cow now coming out in that cohort is like a Wagyu quality that gene is getting expressed. Similar way, I do believe plants and other animals will be going in that direction to uh, to have our food supply chain much more cleaner.
And Anmol, in genomics and AI triage, whether we're talking about embryos, or whether we are talking about fruit, vegetables, or animals, because they've been through the same process, where do you draw the ethical line?
Well, at my ethical line is as long as it's not harming anyone. It's not harming the humans, not harming the animals. So if we are, yes, they are part of our food chain,
Mhm.
and we need some of them for us to grow. Protein, certain omegas, we need them. As long as they've been treated well and well kept, I'm okay with that personally. So if you ask me from a personal eggs perspective, I like free range eggs coming in versus the chickens that are stuck in those farms and been fed antibiotic all the time.
Mhm.
So rather have free range chicken than have a chicken coming in from the big farms and ethically grown and perhaps better tasting too and better healthier for me too. But so this is how I see it that way. So as long
Mhm.
as we minimize the harm for animals and plants, because they are our food supply chain, and if we are not treat them well, will not be healthy.
Now, I have a couple more quick fire ish questions as we're wrapping up our interview and keeping an eye on time. So now that you run clinics, diagnostics company, genomics platform, longevity brand, and a family office, what part of your personality helps you scale your businesses and what part holds you back?
Good question. So never giving up. That helps me move forward. So I don't give up. Impossible is not in my dictionary. And to me, everything is possible. What holds me back? Not having access to the people who can help me move forward at a faster speed. That is the biggest challenge for me. I'm trying to identify those people. It's very, very hard to find the right people. So that's something is holding me back.
And what do you want to leave behind in terms of companies, the impact, or the shift in how people think about their own biology?
Well, I want people to remember me when I'm gone that there was a guy who helped improve living standards of humans and the ecosystem around us. And he helped democratize access, made it more affordable for people, that improved the quality of life and the health outcomes. So once I'm gone, I hope people would remember me with that message.
And finally, Anmol, for anybody listening and is successful on paper, but exhausted in real life, as we all feel at some point, what's the one step they should take this week or this month or in 2026 that will genuinely change their long term trajectory?
Well, if you believe in something and if it is going to be helping others, and it's a good idea, don't let this idea sit on paper. take that one step forward, and you'll come across many other people who believe in you and help you move forward.
So keep faith that other people will believe in you is a good idea to wrap up this interview. Thank you so much, Anmol, for sharing your story so far, and I can't wait to see how you're going to change the world.
Thank you so much for having me.
Thanks for tuning in all the way to the end of this episode. If you enjoyed it, please share it with someone you think would get value from it. And don't forget to subscribe on YouTube, Spotify, or Apple Podcasts so you never miss an episode. For the best way to stay in the loop, head to millennialmasters.net. That's where you'll get all the latest features and new episodes straight to your inbox every week. Catch you next week.